Discussing Body Mass Index Screening, CMS MIPS measure 128. This is a counseling measure, so any counseling documented in ECW needs to be done by the provider. The definition of this measure is the percentage of patients 18 years and older with a BMI documented during the encounter or within the previous 12 months and who had a follow-up plan documented if the most recent, which means last BMI of the calendar year, was outside the normal parameters, either above or below normal. CMS sets the normal BMI parameters for age 18 and older as greater than or equal to 18.5 and less than or equal to 25. The workflow for this measure starts with checking and documenting the patient's weight and height at each clinically relevant encounter, although it is required at least once annually to meet this measure. Once you've put the weight and the height in ECW Vitals section, it will automatically calculate the BMI. If the BMI is above or below normal, it will display as red within the patient's encounter. If the BMI is abnormal, you go to the clinical quality worksheet, and under BMI management, you will be prompted to document follow-up plan for either above or below normal BMI follow-up respectively. Over here in this section, under click here to answer or do now, you will go to above BMI follow-up, click on the pull down, choose the phrase that's the closest to what you discussed with the patient, and save your work. I have now completed this measure for this calendar year. If the patient refuses or cannot get on the scale, you need to think about using an exclusion. The exclusions for this measure include refusal to get on the scale, inability to get on the scale, or too sick to worry about getting on the scale. And if that is the case, under BMI not documented reason, which means the weight is going to be blank in the vital sign and there will be no BMI calculated, you're going to click under do under here and select whatever is the most appropriate. Patient reason, for instance, they refuse to get on the scale, medical reason, or not eligible. Please do not ever use no reason specified. Once you've selected the appropriate choice, you're going to save your work. If the patient's BMI is above normal, but you do not feel that counseling is appropriate, this includes patients who are pregnant, who perhaps are over the age of 65 years old and weight reduction would complicate other underlying medical conditions, you can, even if you have an abnormal BMI, you can select here that you're not going to counsel the patient because you feel it's inappropriate, and save your work. If the patient is in hospice, this measure obviously does not count, and you're going to want to exclude any hospice patients down here at the very bottom of the clinical quality worksheet under Other. And that concludes this measure. Thank you.